This video is going to be a lot of fun because I'm going to tell you a little bit about me. I'm going to tell you what I, as a labor and delivery nurse, would and wouldn't do if I had a baby tomorrow. If you're pregnant, chances are high that you've already started thinking about how you want your birth to look, right? And that is amazing, but we know that birth is one of the least plannable events, on the entire planet. However, that would not stop me from advocating as hard as I could for my personal 5 things that are on my list of things I would or wouldn't do if I had another baby tomorrow. And my list is made up from my experience as a labor and delivery nurse, but also as a mom of 4. And very high up on that list, maybe even at the tippity top, is that if my cervix was not ready for labor, then I would not want to be induced with Pitocin. Now that's not to poo-poo all over inductions, because there are a lot of situations where induction is very valid and very necessary for the health and safety of you and your baby. But if your cervix is not ready for labor, or it's not already in labor, then it's sort of thicker than a Snicker. It is long and it is firm and it is closed. And if we give that cervix that's not quite ready a bunch of contractions through Pitocin in the IV, then what's going to happen is like a truck driving into a brick wall. Not a lot of good things, because you're going to put that baby's head down onto the cervix, which in theory is great because that's what we need to do to dilate it and to thin it. But if that cervix is thick and firm and hard and closed, then all that's going to happen is we're going to be pushing baby's head into the cervix, and that's going to eventually cause distress to your baby without a whole lot of change in your cervix. There are different types of inductions, and on the medication side of things, there are medications to give your uterus contractions, and there are medications to get your cervix more ready for labor. These are known as prostaglandins. You might hear them referred to as Cytotec or Cervidil. Those are the names of the medications, but these are the meds that I would ask for if I needed an induction and my cervix was not ready for labor. And you might wonder, how would my provider know if my cervix was in labor? And it's by an internal cervical exam. Sadly, this is the only way that we can tell if your cervix is ready for an induction of labor, because after your cervical exam, they're going to give you something called a Bishop score. This is basically an overall scoring of your cervix in a bunch of different areas, like how soft is it? Is it dilated? Is it thinning? Where is your baby in the pelvis? And where is your cervix? Is it forward? Is it backward? Or is it kind of right in the middle? And this Bishop score, if it is 6 or less, this tells us that your body is likely not ready for induction, and if we were to do an induction, it would likely not end up in a vaginal birth. But if your Bishop score is 8 or higher, that tells us that your cervix is ready for induction, and if we do an induction, it is more likely that you will end up with a vaginal birth. So basically, on my list is I would love my Bishop score, and I would love to have a chat with my provider about the best method of induction to get me where I need to be. If we haven't met yet, my name is Tina. I am a labor and delivery nurse with my certification in perinatal nursing, and if it's not your first rodeo here, then welcome back. Let's hop right back into the list. Number 2 for me is I would like delayed cord clamping. This is sort of a do not pass go, do not collect $200 as long as I am doing well and baby is transitioning well. And this simply means I would like some time between my baby being born and their umbilical cord being clamped and cut, freeing them to the outside world. What I can tell you about delayed cord clamping is that most organizations, they all agree that this is beneficial for our babies. Now, what they don't agree on, what there's differing opinions on, is how long delayed cord clamping should be. You can see I sort of scrounged around and looked at all the times people suggest. Between organizations, there's quite a bit of discrepancy. Some of them are like 30 to 60 seconds is good, and some of them are 5 minutes or more, or wait till the cord is white. So that is something that you're going to have to sort of pick your own adventure on, and you're going to have to choose how long you would want that delay to be. But what we know is when you delay cord clamping, it returns blood to your baby that was in that placenta. And then your baby has increased blood volume, which means they have increased hemoglobin levels, and then they have increased iron stores for the first few months of their life. And that is just for term babies born after 37 weeks. It's even more beneficial for our babies that are born before 37 weeks because it gives them those great benefits. It helps them to transition to life on the outside. It improves their circulation, but also it decreases their chances of these 2 conditions that are very, very common for our babies that are in the NICU. So for me, on my list, delayed cord clamping. Third on the list, it is short and sweet. I wouldn't care if I pooped. I really wouldn't. I didn't care then, and I wouldn't care now because, guys, it's actually a really, really good sign. Think about if you have a tube of toothpaste and you put your hand down on it and you push your hand down the tube. If there is toothpaste in the tube, where's it going to go? It's going to go out. It is the same thing with poop. If there's poop in there and you put a baby's head down on it, it is going to come out. And just think about it this way. if you poop on the table, and by the way, your nurse is going to get rid of it before you even know, but if you poop on the table, it is going to make sure that you have less poop in you to worry about postpartum. Think about that postpartum poop. It's already done. You don't got to worry about it. Number 4, I wouldn't go into postpartum blind. Think about how much time and thought and effort you have put into your birthing experience. You might have made a birth preference sheet. You might have fantasized about what that would look like, smell like, feel like, who's going to be in the room. But then you have your baby and your nurse hands that baby to you and they say, okay, bye, have a nice life. And you're like, what? And you take your baby home and you're sitting in your house and you're like, now what? So if it were me and I were having a baby tomorrow, I would put a lot of thought and effort into developing a life plan for postpartum. I would think about things like, how am I going to feed my baby? If I'm breastfeeding, I might take a course on breastfeeding so I know what to expect. If I am bottle feeding, I might think about what types of formula do I want to use? I might look into how to safely prepare formula. What types of bottles do I want for my baby? I'd also think about things like, how am I going to get groceries? Who's responsible for making sure that there's food in the house? Where do you live? What season is it? Who's taking care of lawn care or snow removal? Who is visiting and when? Do you have people that can help you overnight? What types of questions do you want to ask your provider when you go to your postpartum checkup? Who's going back to work and when? These types of things, in my opinion, are really, really great to prep for. So that would be number 4. And my number 5 is I wouldn't restrict what I would eat and drink in labor. And that might ruffle some feathers because there's lots of discussion in the obstetrical community between nurses and obstetricians and anesthesiologists and midwives as to whether or not eating and drinking is beneficial for you in labor. And the concern, it comes from the fact that because you're in labor, you might need a C-section. And because you might need a C-section, you might need to be put to sleep. And because you were put to sleep, you might vomit up whatever in your stomach. And if you vomited, you might breathe that into your lungs. And if that were to happen, that is very bad. It can be very detrimental. However, the research behind this is based from 1946. 1946. Dr. Mendelsohn. Yeah, so the research, it's a little bit outdated. However, the practices haven't really changed to sort of reflect where we are now in medicine and technology. So I always say, if eating and drinking is important to you, make sure to do lots of reading and importantly, discuss this with your provider early. Now, I wouldn't necessarily eat a Big Mac because once you get into labor and you get into transition, chances are what you put in your stomach, it is going to come up. So keep it light, keep it fresh. But if it's important to you, yeah, you should definitely talk to your provider. It's on my list to not be restricted because if I feel like eating and my uterus is doing all this work and my uterus is basically running a marathon, I certainly wouldn't run a marathon without fueling my body. So that is something to think about. And if it's something that you want more information on, I did do this big video all about it. It's got a ton of information, including that research from Dr. Mendelsohn. So be sure to check that out if this is on your list as well. And if you like this video, go ahead and give it a thumbs up. I love that you are here. Consider subscribing and I'll see you in the next one. Bye.